Hello, I'm Dr. Sarah Williams here in the UK. Today, we're exploring a silent threat that affects millions of seniors every day. And many of us trust the pills we take without question, thinking they're completely safe. But recent research is uncovering a hidden link between. I want you to pause and consider what you're taking daily. Could some of your routine prescriptions or over-the-counter drugs be distance? Over the next few minutes, I'll guide you through which medications carry the highest risk, how they affect the brain, and what safer alternatives you can discuss.
Every 3 minutes, another senior in America receives a life-changing dementia diagnosis. But what if I told you the real culprit might not be genetics or aging? What if it's something sitting in your bathroom cabinet right now, ordinary medications you take daily? Recent studies have uncovered something alarming. Several commonly used medications, trusted by millions of seniors, may actually accelerate memory loss and cognitive decline. These include prescriptions from your doctor, over-the-counter drugs from your pharmacy, and pills you take without much thought. Pharmaceutical companies have known about these risks for years, yet these medications continue to be widely prescribed. Before we discuss the specific drugs, take a moment to consider what you're currently taking. Do you really know how each medication affects your brain? Have you noticed unexplained forgetfulness, confusion, or mental fog, and dismissed it as normal aging? Share your experience in the comments. I read every comment and provide personalized insights that could help protect your cognitive health. Let's start with something almost everyone has used. That little pink pill for sleep or allergy relief. Diphenhydramine, commonly known as Benadryl. Because it's sold over the counter, most assume it's harmless. But the reality is far more concerning. Diphenhydramine is part of a class called Anticholinergics, which block acetylcholine, a crucial chemical for memory and cognition. Each dose temporarily disrupts your brain's communication system. Younger people may not notice long-term effects, but for seniors, whose acetylcholine levels naturally decline, this can be dangerous. Recent research shows that seniors regularly using anticholinergics face a dramatically higher risk of dementia. One major study found consistent use increased dementia risk by over 50% compared to those who avoided them. The subtle damage often goes unnoticed. Forgetting where you placed items, struggling to recall names, or having trouble following conversations. These are often blamed on aging, not a sleep aid or allergy medication. If your medication is labeled PM or nighttime, it likely contains diphenhydramine. Safer alternatives, like loratadine, do not cross the blood-brain barrier and won't affect memory. Next, let's talk about proton pump inhibitors, commonly known as Prilosec or Nexium, used for heartburn and acid reflux. These drugs are widely considered safe and are even available over the counter. Many seniors take them for years because they effectively relieve symptoms. However, by reducing stomach acid, these medications limit the absorption of vitamin B12, critical for brain health. B12 supports memory, protects nerve cells, and maintains mental clarity. Long-term deficiency can accelerate cognitive decline. Research involving tens of thousands of seniors found that chronic users of proton pump inhibitors had a significantly higher risk of dementia. These drugs may also increase toxic amyloid beta plaque buildup in the brain, a hallmark of Alzheimer's disease. Importantly, many seniors do not need long-term use. These medications were originally meant for short-term treatment. Alternatives include H2 blockers, like famotidine, or natural remedies, such as diglycyrrhizinated licorice, which protect the stomach without harming the brain. If you've been on a proton pump inhibitor for more than a few months, consult your doctor about tapering off. Now, let's consider benzodiazepines, prescribed for anxiety and sleep issues. Drugs like lorazepam, diazepam, and alprazolam calm the mind and improve sleep, but they come with long-term cognitive risks. Benzodiazepines work by enhancing GABA, the brain's calming chemical. While this provides immediate relief, prolonged use changes brain function. Studies following thousands of seniors over several years found that using benzodiazepines for more than 3 months significantly increases Alzheimer's risk, sometimes doubling it. Long-acting versions, such as diazepam, accumulate in the brain and amplify the risk. Over time, these medications create chemical sedation, slowing the nervous system and reducing the brain's flexibility. Seniors often feel disconnected, foggy, and emotionally flat. Family members notice changes in personality and engagement. Withdrawal can be severe, making patients feel trapped in a cycle. They rely on the drug, even as it impairs their cognition. If you take a benzodiazepine, do not stop abruptly. Work with a doctor on a gradual taper plan. Safer alternatives include buspirone for anxiety or cognitive behavioral therapy for both anxiety and insomnia. Next, let's discuss statins, widely prescribed for heart health. Drugs like simvastatin and atorvastatin lower cholesterol and prevent heart attacks and strokes. But there's a cognitive side to consider. Cholesterol is not just a cardiovascular factor, it's essential for brain health. About 60% of the brain is fat, and cholesterol helps form the myelin sheath, which protects nerve cells and enables efficient signaling. Aggressively lowering cholesterol, especially in older adults, may deprive the brain of this critical component. Studies show seniors on long-term high-dose statins have higher rates of mild cognitive impairment. Some report sudden memory lapses, losing track of conversations, or forgetting familiar routes. Not all statins cross the blood-brain barrier equally, so some carry higher cognitive risks. If you've been on a statin for years and notice brain fog or memory issues, discuss dosage reduction or switching to a brain-friendlier version with your doctor. For certain elderly patients without prior cardiac events, the cognitive risks may outweigh cardiovascular benefits. Finally, we need to address the most dangerous factor in medication-related dementia, anticholinergic polypharmacy. This occurs when seniors take multiple drugs that all interfere with acetylcholine. For example, a senior might take diphenhydramine for sleep, oxybutynin for bladder control, and amitriptyline for nerve pain. Individually, each drug impairs memory slightly, but together, the effects multiply. Research shows that seniors with the highest anticholinergic burden have more than double the risk of developing dementia within 10 years. The damage is often subtle but profound. Blocking acetylcholine from multiple angles causes neurons to deteriorate, connections to weaken, and memory centers to shrink, essentially mimicking Alzheimer's disease. Yet, this damage can often be prevented or even reversed if addressed early. The solution is straightforward but requires action. Conduct a comprehensive medication review with your doctor or pharmacist. Evaluate every prescription, over-the-counter drug, and supplement for anticholinergic effects. Tools and online calculators can measure your total anticholinergic burden. Once identified, your doctor can help Deprescribe, gradually removing unnecessary medications, switching to safer alternatives, and rebalancing your regimen. The good news is that drug-induced cognitive decline is often reversible. Many seniors regain clarity, memory, and energy within weeks or months once the anticholinergic burden is reduced. Personality and engagement return, showing the brain is far more resilient than we often assume. This is why I'm passionate about spreading this information. Anticholinergic polypharmacy is one of the most preventable causes of cognitive decline in seniors. Anyone watching, whether personally or for a loved one, can take action today. Schedule a medication review, ask the right questions, and don't accept it's just aging as an answer when it could be medication-related. Share your experiences in the comments. Are you taking any of these medications? Have you noticed changes in memory, focus, or clarity? Most importantly, are you ready to advocate for your cognitive health and schedule a review with your doctor this week? Your brain is worth protecting.